as the director of the NCCIH, you are building connective tissue, as it were, between the different institutes, as you said. So how much of that work directly supports this newly emerging focus that you're speaking of in relationship to whole person health?
Well, there's excellent receptivity at NIH with these ideas. We have a trans NIH working group for whole person health with senior leadership from many different NIH institutes. We also held a workshop on whole person research that was very well received. And we're in the middle of developing now a framework for research on whole person health. So these are ideas that are very, contagious. there's interest in this, that is very broad. And we're very happy that we've really secured some, very diverse partners on this. For example, the National Institute of Environmental Health, Nursing, Aging, Child Health and Human Development, to name a few, and minority health and health disparities. These are all institutes that are not what we call categorical. Mm-hmm. These are institutes that already are thinking in a very integrative way. And also a lot of the offices at NIH, offices of research on women's health, preventive health, also behavioral and social sciences. So we have a lot of partners.
That's a lot. That is a lot. That's fantastic to hear. Mm-hmm. And I did see that you published a paper last year on your perspective on whole person health. So that's available, right? And this webinar that you said, or this workshop, is that available for people to, to watch?
It's all on our website. It was videotaped. And I really would encourage anybody who's interested in research, because it's a little daunting when you think about it. How do you do research on the whole person, Mm-hmm. Well, the idea is that it's really research that's integrative, that takes parts that can be thought of as separate and put them together. And so you need methods to do that. It's a little bit more complex, but it's definitely something that than simply doing research on one particular outcome or simply the effect, for example, of a drug on one system. If you think about the effect of what we call multi-component interventions, if you're going to have interventions that address, for example, nutritional aspects, physical, psychological, together, it's not as simple as doing research on a, for example, on a drug, but there are definitely a lot of new methods that can be brought to bear on this type of problem, which we discussed at the workshop. Mm-hmm. Very exciting to understand. How do you study interconnected systems? How do you study the impact of multi-component interventions on an interconnected system? So it's very nice. It was very nice to see the community come together about this.
Okay, so that workshop actually provides quite a bit of guidance about how you see the research could be conducted.
Very substantive.
And the NIH, NCCIH in particular, is providing funding to support this kind of research in the field. Is that correct?
Well, not just us. I mean, this is efforts that are going on throughout NIH, but certainly at NCCIH, we are really dedicating some specific efforts towards developing those kinds of programs. Yes.
Okay.